Hello friends, Dr. Pranaya here. Everybody is concerned if we start using minoxidil, we get hair fall, and even if we stop it, our hair fall again comes back to the original state. Why so? Every medicine has its own mechanism of action. Minoxidil has the mechanism that it reduces hair fall, but initially as you start the medicine, there is a temporary shedding time. Even when you stop using minoxidil, there is induced shedding. That is why your hair fall again goes back to square one. Here, the very important thing that you have to understand is you should not stop minoxidil. There are variety of tapering ways that you can slowly taper minoxidil and replace it with some other medication which you can tolerate. Ideally, minoxidil when it is started, you have to continuously use for minimum of 4 to 6 months. Some people use it just for a week or 2 weeks and they feel that the hair fall is increased, so they stop it. It should not be done like that. You have to continuously use the medicine for 3 to 4 months minimum to say that it is not working for you. Actually, after 3 to 4 weeks, the hair fall which is induced by minoxidil will stop and you will start getting the hair growth. But it has to be continued for 3 to 4 months. If you are not able to keep the compliance, if you are not sure that you can use the medicine regularly, better you opt for some other medication which won't have the side effect of hair fall after stopping it. Then what is the care that you have to take before using minoxidil? If you have dry scalp, if you have dandruff, if you have oily skin, if you are very sweaty, or you have certain scalp condition like psoriasis or seborrheic dermatitis, you have to take care of that prior using minoxidil. Because if you are starting minoxidil and your skin condition or your scalp condition may get aggravated. So treatment of all the scalp condition or dryness or oiliness or dandruff is very mandatory. Sometimes after using minoxidil, you tend to get pustular lesions like pus filled lesion on the scalp. You tend to get a lot of dryness, irritation, itching. That is the time you have to stop the medicine and inform your doctor that you are having these symptoms. Sometimes when you have palpitations, changes in blood pressure, migraine or chronic headache, such people when they use minoxidil, their symptoms of headache or palpitation will increase. Even in their case, minoxidil should not be used. For males, when they are planning to start minoxidil for their hair fall, it is good to keep the hair short so that the medicine can be applied properly and absorption can happen better way. So do not keep long hair when you are using minoxidil on the scalp. Now, what all precautions you have to take after applying minoxidil? As I mentioned, after you apply minoxidil for 4 hours, you cannot use helmet or any head gaskets. After applying minoxidil for 4 hours, you cannot immediately go to bed. You cannot use any salon parlor procedure for your hair like curling, straightening, keratin treatment when you are on minoxidil application. Immediately after applying minoxidil, you have to wait for 4 hours. You cannot shampoo, color or oil your hair after that. If you want to use a hair dryer after application of minoxidil, again you have to wait for 3 to 4 hours, then only you can use it. I will be detailing you more on medication that are combined with minoxidil, medication that can be a substitute for minoxidil, oral finasteride, topical finasteride. So keep watching the video.